And look good?
Looks good. Can everybody see that?
Yes.
Awesome. All right, so while we wait for others to join, we're just going to go ahead and dive right in. Thanks for being here. Good to see your faces. And thanks for joining us for those of you who are newer to the crew. As you all know, and as we like to say at the top of each meeting, we're coming together to organize the healthcare sector in New York City to be responsive to industry demand while improving employment outcomes for young adults and their communities. And the next slide, please. We also like to highlight these norms for working together at the top of every session as well. But as always, we like to say we love seeing your faces. So thank you for keeping your camera on. It helps us stay engaged with you all. And please remember that your honest feedback and radical candor and active participation will make our work together better. And there's someone in the waiting room.
Got it.
Thank you. I'm going to wait for her to join because next up is some intros because we have some new faces with us. How's everybody doing though while we wait for her to join? Good? Thumbs up, middle, yeah, thumbs up. Ooh, I like that. All right, it seems like Justina is trying to connect to audio. Let's just go ahead and go to the next slide so we don't put her on the spot. So as we normally do, quick around the rooms to get us kind of warmed up and in this space together. And like I said, we do have some new faces here with us. So I want to make sure we give them time to introduce ourselves. So let's introduce ourselves as we usually do with our name, organization, role. And then our question to answer today is if you could go back and tell your younger self anything about the workforce, what would it be? And then just popcorn it off to someone else in the room. And I can go first. So I am Megan Marshall. I'm the manager of Work Solutions Jobs First NYC. And if I could go back and tell my younger self anything about the workforce was that if I had a career path that was a bit curvy, that's okay. People who just graduate or finish a training or whatever and stay in the same career field is actually the exception and not the norm from my perspective. And it's okay to not know everything. Hashtag always be learning. And I'll popcorn it off to Stephanie.
Hi, good morning, everyone. My name is Stephanie Aviles, and I am the director of the Careers That Care program at Cypress Hills, which I oversee the healthcare program and the CDL program here. So if I could tell my younger self anything about the workforce, I think it would be to take more electives or in different areas in college, because I think I just stuck to forensic biology and sociology, and I should have branched out a little bit more. I think I would have tried different things. And I'm going to popcorn it over to Curtis.
Hello, Curtis Dames here. I'm the acting dean for academic innovation and career success at Gutman Community College. Happy to be here with you all. I would tell my younger self that one of the most important things in a career is your manager, and most people leave managers, not jobs, and to really think about that from the beginning as you move along in your career. I'll pass it off to Dan the man.
Thanks, Curtis. Good morning, everybody. Daniel Augusto, Managing Director of Workforce at Phipps Neighborhoods. I would always jokingly say I tell my younger self I should have become a fireman. But if I had to honestly say, I would probably tell myself to just earlier on was to remain authentic and don't let the room, dictate my actions. And I will popcorn it over to, is it Jean or Jeannie?
Yes, it's Jean. Good morning. Thank you. I am the clinical director for the Isaac Center Education and Workforce Development Program. And something I would have told my younger self, it relates a little bit to what Megan was saying. I was always hopping jobs because I didn't like the environment, and my mom was always worried that I was gonna just keep doing that forever. And since coming to Isaac's a year ago now, it has paid off. I love the people I work with and I love the environment, and it absolutely, Curtis, is related to management. So keep looking and you'll hopefully find it. I will pass it off to, I think Carrie hasn't gone yet.
Unmuted. Thanks, Jean. Welcome, everybody. Carrie Fallhaver, Vice President at Jobs First NYC. I'm in the vein of Megan and Jean because I've probably worked in at least 8 different sectors. So 2 things I think I would tell my younger self. One is it's not too late to change careers. And the other is travel more before you start working. And Justina, if you can come on camera or off audio, I will popcorn it to you.
Hi, good morning. I am Justina Sharrock Brown. I basically oversee our workforce development department at the Isaac Center. And one thing I would tell my younger self is to explore the sort of opportunity programs that exist that allow you to explore careers without having to pay for it out of pocket. I don't think I realized how many opportunity programs existed until I started working at the Isaac Center. And I'm like, I probably would be an IT professional had I known that programs like Perscolis and like Knowledge House were out there at the age when I was trying to decide what it is I wanted to be. And also trust yourself.
Thanks, everybody. I feel like some of that advice I'm going to take to heart today, not even just for my younger self. I appreciate that. Again, it's really nice to be here with all of you guys and appreciate the good vibes you're bringing. So let's go ahead and we're going to pivot to what's on deck for today. Carrie, I'm going to ask if you can share again so I can go through the agenda.
Getting there. Juggling screens. Hold on.
Take your time.
Okay. There you go.
So our agenda is pretty straightforward. Because we have some newer faces and some people who weren't here during the last couple sessions, we wanted to review our service delivery model examples that Carrie went through previously to get everybody kind of caught up and on the same page. And then we're going to have time to collaborate on a worksheet in some small groups. It might end up being maybe pairs for this smaller group that we're in right now, answering a set of guiding questions. Last time we gave people a chance to talk about this and think about it individually, and now we want to kind of make that collaborative. So we'll do that first, and then after that, we're going to revisit some of our other kind of pending implementation tasks, review what those are, and then set some deadlines for completing those. And then we'll have time to share out and discuss all of this stuff as well. Next slide, please. So with all of that, we hope to come out of this meeting with some additional group recommendations on service delivery, understanding, which partners are going to play what role in activating and completing our partnership goals and activities, as well as I said, some deadlines for other pending deliverables. So we hope to walk away with answers on some of those things today. Does that sound good?
Yeah.
Awesome. And with that, I will pass it off to, thanks for the heart, Justina. I like that emoji. I'll pass it off to Carrie to get us started.
Thanks, Megan. I can't see, am I on mute or off mute?
You're off mute.
My mic disappeared. Okay. So we're going to review the service delivery models. We not all of them that we did last time, because I think maybe Danielle, you might be the only one who saw this already. So it'll be a little bit of a repeat, but some of them were complicated. So hopefully it's a good repeat for you and new for others. So because today together, we're going to tap into your creative brains Or maybe you could look at them as logic brains, or a combination of the two, which some of us don't necessarily think we have, but I bet we could inspire those in you. We're going to work on drafting a service delivery model that aligns with our mission, this partnership's mission. When I say our mission, this partnership's goals and this partnership's targets. Megan, if you have a chance, I don't think we have slides for those. If you want to drop those in chat for any new folks, the mission, goals, and targets, if you have them handy. And recognizing that we have some newcomers and a few people who weren't able to make last month's session, we want to revisit this service delivery models examples and talking about what it means before we go into a small group deeper discussion. So with that, let me just give you what we use as a definition for a service delivery model. It is a blueprint or a framework, and it's a visual for how to organize and deploy people and resources, which is us, the healthcare sector network, and anyone else we might bring to this table, and how the mission is achieved and realized through the activities the partnership is leading and participating in. So let's quickly just revisit some of the examples that we showed you. So this might look familiar to some of you, and Megan, you also might have shared it out in advance. This is an example, an early example of Youth Wins, which is the Workforce Initiative Network, Youth Workforce Initiative Network of Staten Island that Jobs First helped form many years ago, maybe 2016 or so. And it's a collaboration of several Staten Island-based organizations with experience delivering social, educational, and career services to young adults on Staten Island. And this first example of their service delivery model was, I would call it what we looked at as a public-facing version. It's pretty straightforward. It's easily digestible. You could kind of look at it and say, okay, you know, everyone has a role here and it makes sense. It's linear in some ways, and then it's circular, as you can see. And it shows their flow of service without, you know, getting too in the weeds. Then the next one is more the inside baseball, which you'll see when you look at it. And you've seen this before, the folks who were here last time and who were in person. So, you know, participating community-based organizations, they partner. This is what this is showing. So you don't have to read every detail. I'll give you like the high level. They partnered with the College of Staten Island to offer educational bridges, customized training, and wraparound support services to out of school, out of work young adults on the island. And as a member of the partnership, the Chamber of Commerce, let me see where, they're in this sort of ongoing career prep, employer feedback. They played the role of connecting people who completed training to employers on the island, because that's their constituents, the Chamber's constituents. And they're an employer intermediary. And so they help the newly trained certified young adults secure jobs. And Jobs First serves as a capacity builder, a coordinator, a convener, and we supported them in raising resources to implement this model. So brought a lot of new money to Staten Island. Some of the largest grants they've actually ever received on Staten Island were because this partnership was formed. And oops, sorry. There was something else I wanted to say of this. Oh, so hopefully you can see from the two models, the one before this one and this one, that the partnership is collaborative. It has multiple on and off ramps. It's employer facing. It's participant centric with support before, during, and after training. And they developed a model that emphasizes long-term career readiness needs of their young adult clients and responsive to market demand by weighing educational attainment, certification. We use a lot of labor market intelligence to choose these tracks. Technology, healthcare tracks at the time. This is what was in demand on Staten Island, right? They wanted opportunities for people to not have to leave the island. And the other key thing that I want to state is that no one agency in this partnership offers everything you see here, right? So they act collectively, and the partners of Youth Wins are able to offer much more comprehensive service together than what they could provide independently. And then this next one, many of you have probably seen in a variety of reports. In 2014 or so, the city put out a career pathways report, like one city, I forget what it was called. I should remember, I always bring it up and never remember the name of it, but the Alliance for Quality Career Pathways, this is their model. They worked with CLASP, they're actually a group within CLASP, and they identified 3 core features of a sector career pathway. And all of our partnership models focus on a sector career pathway. So we keep this kind of at the heart of it, right? A well-connected quality education and training program that results in credentials that are valued by the labor market or by employers, include support services, work experiences, and employment services. There are multiple entry points that lead to progressively higher levels of employment within a career path. And there are multiple entry points for targeted populations, starting from an initial level of education. You know, you always hear the expression, meet people where they are, right? Some people need an HSC. Some people have an HSC. They want a certificate training. Some people have a certificate training. They want a college degree, or they want a new skill. They want to, you know, stack a credential. And so this pathway is really showing, you know, the sequencing of that. And it focuses on the holistic needs of both workers and employers. It integrates all resources into a single career pathway plan, and it engages service providers, training institutions, employers, and it meets our collective work, right? It's what we want to do together and how we as a network of providers can be more impactful longer term for more people. So I said a lot and you looked at a lot. Tell me if you want me to, you know, kind of flip back to any slides. We'll share these with you. I think they're maybe in the public folder, or they will be after this session. But I just want to pause and give the mic to you all to ask any questions about the examples or about service delivery models broadly. Daniel's like, I got this. I saw it already.
Stephanie saw it too.
Oh, great. And some of you may be familiar with some of these. I think, Curtis, you saw some in person. Okay. It sounds like we might not have any questions, but you all know at any point we're, you know, a small close group here, come off mic and ask anything that you want at any time. And then with that said, I think, Megan, you're going to take over and set us up for some breakout activity, right?
Yes, I am. So before I like fully explain the activity, I wanted to just very quickly review some of the themes that we've heard about service delivery from you guys. So I just want to quickly go over that. Let's see, there we go. So during the February session last month, that session's feedback form, last week's gathering, thank you to those who joined, shout out to Curtis and Justin and Daniel. We heard some priorities and themes around thinking about ways to make our collaboration easier, some sort of like referral system, developing some sort of platform or portal to highlight our training offerings within the network, and also our participants, so employers can view their skills and certifications and all that good stuff, and making that accessible to all parties that we want to target within our partnership. We've heard some themes around work groups, aka like subgroups of the full network, to kind of go after some of these specific strategies. Some of the work group focuses, if you will, that have been raised are on employer engagement, union engagement, developing training, some of our job fairs and career events. Somebody said maybe that could be a work group, and then the policy and advocacy as its own kind of side project of our partnership, if you will. We've also heard, you know, wanting to put really good focus on creating those universal data metrics and tracking our outcomes as a collective and making sure we're intentional about that. A couple people mentioned wanting to do site visits as a way to share best practices. I don't know if that's in service delivery, but it's a theme that I've been hearing. And then some other themes are to have some sort of common assessment to match students to the right fit program, as we kind of guide them through what our network service delivery will look like. Oh, I forgot one. And part of the site visits thing, someone was talking about wanting to better understand how our trainings across the organizations differ so that we can efficiently stack them along, you know, an upskilling and advancement strategy. So I think thinking about that is really key for whatever mechanism we think about for flow of service and how we want to make sure we do have that clear understanding and how might we get through that. And then on the next page, I'm not going to stay too long on this one, but we've also received some visuals from the February session and last week's in-person session. We started drawing a little bit to help inform, you know, how we might visualize these ideas as we work towards kind of a formal thing, like an example Carrie was showing. These images are in today's public folder, which I will share shortly. So they're going to be there for you to draw inspiration from while you're in your smaller groups. And I'm just going to go ahead and drop the link to that public folder now so you can have it. Carrie, I see you copying it. Are you ready? Thank you. Thank you. All right. I wasn't sure if you needed help. So again, I put those contributions in front of you because we want to build on those ideas so that we can come away with some additional clear recommendations on what this visualization and kind of flow of our efforts should, could, and will look like. And as I said at the beginning, you know, last session, we gave you time to kind of review and reflect and contribute as individuals around these ideas. And today we kind of want to give you some collaborative time to talk to each other through the guiding questions to see what that might inspire also. So when we send you off into breakout rooms, we're going to give like 30 minutes, a big chunk of time for you guys to review materials so that those who haven't been here and are newer can get a little caught up. So you can look at the logic model, the service delivery examples, et cetera, and the drawings that were submitted. And so the majority of your time, you'll review that, and the majority of time we'd like you to spend working together, answering a set of questions in a worksheet. So as a group, discuss and complete the worksheet to the best of your ability. And we recommend having, you know, an assigned scribe to write directly into the doc, and to also assign a person to share out for your group when we return to the main room. Does that make sense so far? Awesome sauce. So we're going to be working in the same doc, so I want to make sure I explain this. Can you go to the next slide? When you open the worksheet, you're going to see this table of contents at the top, what you see on the screen here. And so when you get sent to your Zoom breakout room, I've said this before, but pay attention to the room you're sent to, because that will be your group number. So if you're sent to Zoom breakout room number 1, you're in group 1, so on and so forth. So when you open this document, you'll click on the group number and the table of contents, and it'll go to your section, because we're all going to be working in the same document. So it's broken up by sections. And we really want this to be in your voice. So Carrie and I will be like jumping in to help out in the breakout rooms, but we're not going to stay in them the whole time, because we just want you guys to have time to talk with each other. Does that sound cool? Awesome. So let me drop the worksheet is in that public folder, but let me drop the link to the worksheet specifically. So we have it, if I can. Okay. Does anybody have questions about what I just explained?
No.
Thank you. Can everybody open the document? I want to make sure that you can do that. Okay, great. And Carrie, I know we were going to do groups of 4, but we have a smaller group here. So should we do 2 groups maybe?
Yeah, we do 2 groups, and then if people come in, we could, I know a few people said they were going to be late, and I got an email that they're still coming, so we could probably separate them into the existing groups, right?
Okay, yeah, that sounds good. And I can set those up now.
I'm gonna
Yeah.
stop sharing so I can re-find everything on my screen that's missing.
Sorry, guys, give me 1 second here. Okay, so let's do that, and then sorry, guys, you're watching me struggle with technology in real time. It's really great. Okay, I'm gonna send you to breakout rooms. Any questions before I send you off on your merry way? Okie doke. We're here if you guys need us, and then we're gonna pass around also. So off I send you.
Is Daniel frozen?
I think he's frozen.
I'm not gonna join for a minute because I'm emailing people.
I just realized I put Curtis, Daniel, and Jean in the same one, and then Justina and Stephanie.
Oh, separate Curtis and Daniel.
Okay, I'm gonna move Daniel to the room too. But then Curtis is a new person.
That's true, but he worked on, do whatever you think. I try to separate the males.
Yeah, I moved Daniel to room 2. I think Curtis can. Oops, hold on. Hey, everybody. Welcome back. Did we cut you off in the middle of a sentence? I'm sorry.
Maybe, but I made my point.
Oh,
Sorry. All right, so we would love to hear how that went for you guys. Any volunteers to share out first from either group 1 or group 2? I don't want to put anyone on the spot, but I can.
I guess we'll volunteer tribute for group 1. Is that okay, group 1? I mean, 2,
Yes.
sorry.
group 2. No, yeah, go ahead, Justina. You're good. The music was too loud in the gym. You got me. That's a group joke. My bad, yo. Go ahead, you got it.
So I will say I enjoyed our group because there was like a span of knowledge across like workforce and our experience. So for the first question, in reviewing the logic model targets, how do we think they can be achieved together? So definitely touched on upskilling and referrals in the network. So leveraging several funding sources from each provider. We recognize that sometimes we have contracts that are very specific and ask us to target very specific demographics of people. They can't be working, they can't be in school, or one or the other. And so, or we might not have extra funding for things. So for example, I have a WPP contract. Maybe I can have folks from Cypress Hills come and, get paid to do a training through that WPP contract, and so on and so forth. Gaining partner knowledge to inform on current programming needs. So what is it that my program needs versus their programs, and how can we sort of come together to make sure that we meet those goals? And then determining the pathways we want to focus on specifically. Healthcare is huge. There's a lot that you can do within healthcare, but narrowing it down would probably make us more unique. As you know, there are several programs out there that offer or make the same promises about outcomes. So we want to make sure we're very specific. For the next question, the flow of service, what does that look like between partner organizations? So we thought it was very important for each organization to identify a singular point person that's able to facilitate referrals to and from the network, and then have a dedicated backup person in each organization that's able to ensure the model flow continues, and it's not disrupted by their departure or their brief absence, so on and so forth. Continued connections within the workforce field to maintain and gain knowledge of the healthcare landscape. data sharing agreements, very, very important. So, making sure that we have, program outcomes that we need to report on. So by creating these partnerships, making sure that we're able to sort of report on the data that's captured at each of these sort of referrals. And then this is the point that we added last, but it was sort of where we ended our conversation on strong employer partnerships. It's a two-way street, right? And so it's one thing for us to sort of do all of these things, to prepare these clients for job opportunities, and then not having employer partnerships or employer partners who are very involved, able to identify what it is that they need from candidates and actually speak directly to the candidates as opposed to having us do it for them. And I think we're going to come back to that point after I finish. And then the next question, sort of guiding job seekers. So we want a centralized mechanism where job opportunities are visible and accessible, like a job board. So they're able to say, oh, this program offers CNA training and it's absolutely free, but it's at nighttime. I need that. And they can click on that and it takes them directly to the organization that offers that opportunity. Information sessions about programs to identify the requirements, differences, and needs to be met per program, and then shared assessments to review to determine overlap areas, right? So one thing when you are sort of partnered with an organization, there are already a lot of there's a lot of paperwork you have to fill out, applications per program. And so figuring out a way to minimize that and meet sort of each other where we are for those requirements. And let's see, sorry, I'm going fast because I'm trying to be mindful of time. The job seeker's journey. So how we assess job seekers. So one, alumni engagement. We sort of talked about the what versus the how, right? Because for me at our program, an alumni is considered anyone who has gone through and successfully completed a program. And that might look different at a partner organization. And so how do we identify what an alumni is, and then which organization is engaging that alumni, or how are we working together to make sure that they are engaged throughout the job seeking process and they're not sort of disengaged because they might not be hitting all the jobs they apply for. Universal healthcare assessment form shared amongst the partners. So taking an assessment that shows you, these are your skills, these are the jobs that we think you'd be a really good fit for, but resource tools available through partners in the network like ONET and Pathway U to make sure that happens, and then making sure that there's coaching provided so that they understand why the assessment is saying that. And then finally, identifying a point person in each organization to facilitate. Oh, so we sort of touched on this in an earlier question. And we're like, oh, we kind of answered this already. So making sure that we have a point person. So Cypress Hills has a talent manager who would be the example point person for them, but they also are a job developer. So it would make sense for them to facilitate the referrals at that organization. And then assessing, leveraging existing employer partnerships for opportunities. So we all probably already have our own established employer partnerships. And so making sure that we can sort of use that within this network. And then I'll turn it over to my group to add anything I might have missed. The coffee kicked in, y'all.
Justina, you did great.
Yeah, awesome. I thank you, Justina, for doing that. So I did have a larger question that Justina was referencing to, and it's really around employer partnerships, but I don't want to stop the flow of allowing group one to go. So I just want to put it out there when they're done presenting, and then I just have a question and some insight I want to pose to, I guess, more specifically Carrie and Megan, just so you're aware. Thank you.
Great. Putting a pin in it.
Group one, I think that means you're on deck. Or you're up. I don't know my terms. Group one, you're up.
Okay, I guess I will talk. So it was a little bit of a learning curve for me because I'm sitting in to help. So also being the clinical director, I look at a lot of things from a social support perspective, but we worked sort of independently with Curtis and I putting in our different ideas into each question. So I will talk a little bit about my overview feelings. And then Curtis, if you want to hop in and talk a little bit about what you said. I think for me, our biggest struggle is finding partnerships that are willing to support our specific population in the way that they need it. I think that we currently have some great partnerships. And Justina, who wasn't in my group, knows a lot more about those. So I wasn't able to be too specific. But for example, you know, we have a CNA training program that we do things around with a New Jewish Home. And they're really great in terms of being able to place them in employment and sort of stick with them for the long term of the program itself. So for us, I would say we get participants in through that kind of program. If we have GED participants who are interested in healthcare, we can place them in training programs. I was talking to Curtis a little bit about college partnerships. I think we could do a little bit better there as an organization if we have students who actually want to go into college, and that's another way to get into the healthcare sector. I think that recruiting individuals and being able to identify from a social support perspective and also a work readiness perspective what their barriers are to success, and then finding a partner who is willing to sort of meet them where they are and, you know, communicate with us about any concerns they might have, communicate directly with the participant, and then we're able to be more proactive and sort of swoop in and give that extra support around maybe it's interpersonal skills or time management. I think for the Isaac Center, sometimes we find out after someone's already lost a job because there's sort of a gap in communication there, and it would be really helpful if we could step in sooner to keep them placed.
Awesome. Sorry, I was like typing notes. So I
Are
couldn't-
you, do you want to go question by question? Curtis, you want to weigh in?
I can just say kind of overarching theme, and I don't know if Tara, you want to say something as well. I think the overarching theme that I kind of was writing to and I've been thinking about a lot in terms of partnership is just understanding where we are in terms of the economy right now and historically low unemployment rates, and which kind of translates into less people interested in workforce development and training, because you can get into the workforce without training in many ways now is different than when there's strain on the economy. So thinking about what does partnership and flow of service look like? Just, you know, having a really big focus on recruitment and building a large enough pool of interested individuals where we can actually see this as like partnership. There's enough people where everyone is finding some mutual benefits and really focusing our efforts, at least in the short term, while this is the economic scenario around doing lots of shared work and, you know, in the like info sessions, recruitment, shared marketing. That's also where you could get some economies of scale that would be beneficial to everyone. So I shared about that and put a lot in on there about how do you build something that's that we have enough people where it feels like a partnership and we can move away from competition. But when there's scarce resources, you know, and those would be individuals interested in training, it's hard to not be competitors. You really need excess individuals to be thinking about partnerships instead of competition. So like a lot of the stuff in there was focused on how do we, you know, front end our efforts there. And then if you get enough people, then it's a really nice service delivery model of, you know, you can easily, you know, point people to the right CBO providers, partners in this network. But if we don't have enough people, then you're going to want to hold on to your own people who come to you, and you're not going to want to share out. So just kind of talked a little bit and wrote a little bit about that.
Thank you, Curtis. That is a helpful perspective for sure. I hadn't thought about it as much in that way because at Jobs First, we're so focused on out of school, out of work young adults, and the numbers are up since pre COVID numbers were going down so steeply. So I don't think as much about the like dearth in talent. But we are still hearing from programs that they're having trouble recruiting folks. So, why is that? Are they working even though they don't appear to be working because they're in this sort of uncaptured gig economy?
Yeah,
Yeah,
or gray
more
market.
questions
Yeah.
than answers there. What was that? Sorry.
Yeah, or the gray economy, yeah, stuff like that, where they're off the books but doing work. But yeah, Tara was talking about too, they're having some struggles with recruitment. I don't know if Tara, you wanted to say anything or share any of your perspective.
No, it's just, I mean, that I'm in here as well, just in place of Jill, who normally attends these meetings. But as we were talking about recruitment, and he was talking about 18 to 24-year-olds, we are having an issue trying to tap into that population. So we're just trying all different ways to really get those 18 to 24-year-olds into training and allowing them to see that we are offering more than just a job, but more of a career pathway.
What are some of the things that you've been trying so far, and what have you, like, what has really not worked and what is like, oh, maybe there's some hope in this strategy? I'm just curious for myself.
No, that's fine. And it's a great question. Unfortunately, I'm not in recruitment, so I don't really know. I just hear that through my role is, I was just telling the team that to expand Strive into other cities. So like we're starting in Birmingham and so forth. That's what I do. But I think the team has just, they've really hit like kind of on the ground, really grassroots efforts to just tap into any particular market where they can either, like high schools, I think they've started out at, we do have like a juvenile justice type program. So they've been looking into parole and probation. I know those are some of the things that I've heard that they're doing. So they are doing out of the box. We attend a lot of events, have tables at a lot of events as well. So sometimes that seems to be bringing in a little bit more people. I know that this last cohort for the 18 to 24-year-olds have had the most that we've had since early last year.
Awesome. Thank you. That's good to
Mhm.
hear.
Yeah, I also wonder, like, is there like a little bit of a shift in this because there's so many layoffs in tech? And I did hear, I have heard about some interesting strategies of like recruiting from non-traditional healthcare populations where I was on a webinar, I can't remember whose webinar it was, but they were talking about this program somewhere in like the Midwest that is recruiting in high schools and community college from sports teams, like athletes who, think they're going to get like a scholarship to college or something like that. And of course, not everybody does. And they want to increase the male population in healthcare. And they're finding that there's aligned skills, like in when they assess people who are in teams, that there's a lot of aligned, like the thinking around working in a team, working in healthcare, and they care about the body, they care about health. And there's a program who recruited a whole cohort of young men, young athletes, and they had really great success in that. So yeah, I guess there's some outside the box thinking that we have
to be. Yeah, but that's interesting. That's an interesting concept. So yeah, thanks for that idea.
Yeah.
Does anybody else want to contribute general thoughts or thoughts on what we're talking about right now before I pass it back to Daniel for his question?
I mean, the only thing I would say to that is, I think I would agree that there's been struggles in identifying people to come into our program. I think most of us are in the same, age bracket in terms of 18 to 24. Our program actually goes to 26. So there's a little bit of wiggle room there. But we see a lot of people. I think what we've found for the last few cohorts that we've been running, there's a lot of people already in connected to school, right? So, some way, shape, or form post-secondary, which is great, from an education standpoint. But it's like, hey, you have these classes that we can't necessarily, make sure that their schedule would allow, for them to be able to come into our program. There are some other people that are working. It might be gig economy. It may be gray economy, like Curtis mentioned. I think another thing that no one is really overtly stating is I really feel like as a overall result of COVID and people just kind of being used to being virtual and kind of sitting back and being home. It's like, what these programs are kind of, we're offering the same thing pre-COVID, right, as we have been. And I think there's some expectation, especially from a younger younger population. Is like, well, you did that before, like COVID has changed everything. Why can't I do this from home? Can I get interviews from home? Can I work from home? If that's not possible, like, I'm not even going to bother to join, right? And that's like one example, but I think y'all understand kind of where I'm going with this, because I've heard similar things even from just general population, 18 and up. Overall, when it comes to work, I see it all the time, with SYEP. We're serving well over 1,000 kids, and I can't tell you the amount of not only kids but parents that are like, well, can't my kid work virtual? And I'm like, they could if there were enough virtual jobs, but there aren't, so they're gonna have to do this work in person. So it's a thing, it's a real thing. I think that a lot of that factors into the other pieces that I just mentioned when we're talking about overall recruitment of young people or the OSOW population in general.
Yeah, that we talked about this a number of months ago now, of like, how do you balance the healthcare jobs for the most part are going to be in person and hands-on. So like, how do you even balance what you're talking about with what those career pathways entail? It's I don't have an answer. I'm curious. We should keep talking about it.
Yep.
Sure. Anybody else have thoughts about that? Daniel, you had a mic drop moment. I think we're all agreed.
I don't know if I call it that. I just like everybody, they're good.
Yeah. Did you want to ask your question or?
Yeah, so obviously we talked about everybody being candid and just being a space about, and I know we've been you both know we've been doing this work for a while, and I guess today I had that like a brief moment of clarity, Carrie, before when you were going over the visuals of the service delivery models, right? Particularly the career pathways one. So I know that was the one that the city issued and worked on. And immediately what I thought of was like my sense, like as a person working in workforce and then talking to other people, when that on paper was great. And I think when the report came out, there was a sense of like, this is a really big report that came out, from the mayor's office, but it's like, who did they actually talk to? Because they didn't talk to us. I know they didn't talk to these people. I know they did. They talked to, it was kind of like they picked and chose who they wanted to talk to. And I know that they definitely did a lot of stuff with employers and certain city agencies. And so I immediately thought about that. And then I'm thinking about what we're doing. And I'm like, I don't know what I don't know, but I'm like, we're talking about a lot of really great stuff. And I'm looking at the people that have been consistently evolved, new people, right, that are coming into this group to work as a network. And the thing that hit me was like, we don't have any employers here to talk about this. I know we talk about employer engagement. I don't know if you all have done any footwork to try to identify employers that will be open to be a part of this, because I know it's we're all busy and it's time consuming, and we all make the commitment to do this because we all recognize it's really important work and it impacts our services and the work that we do. But I'm like, we need to have like at least a solid one, maybe two employers to be a part of this, because I feel like we're saying all this other stuff, and if they hear what we're talking about, the things that we offer and that we do, I think there'll be a more of a like, hey, if this makes sense and we can get so and so on board. But I think on the reverse of what Justina mentioned before about it being a two-way street is like, we're asking a lot of things and we're saying stuff, but there's also this level of like, we don't know, there's this uncertainty, and a lot of that really comes from, like Curtis pointed it out, like the job market. What does that look like? And if we have the employers that are there and they're at the table, I really think it helps kind of bridge a gap on a number of things. I'm kind of just like, I don't know, it just hit me today, and I'm like, we don't have any employers here. Like we need to identify some. I don't know if you've done that work, and they would just like tell us when you're done, and then we'll think about it, or what has been done and the thoughts around that piece.
So that's a great conversation for us all to have, right? Because I will say, we brought Memorial Sloan Kettering here. And I'll be very candid, and I'm not pointing any fingers, but nobody followed up with me to, I made offers to kind of like continue that conversation. They're looking for potentially developing some sort of like customized training, and I also will give the caveat that they had like a start and stop themselves of figuring out their own demand. So it's not like everyone's all ready at the same time too. But at that meeting specifically, they kind of put an offer out there, and maybe we weren't in this like sort of united place yet to be really ready and to be thoughtful about it. But there's opportunities and we can bring them. I guess, yeah, I'm wondering like, what's the right point? What's the right timing? Like if we have a proposal of how we will operate together, and this is all coming together here in these documents now, I think we could look at it two ways. Like, do we want employers at this table just to hear what we're talking about now and to inform what the partnership looks like and what it builds toward? Or do we want them at the table when we feel like united, as when we can talk to them as a healthcare sector network, not as FIPS, not as Gutman, not as Isaacs, but because that's what they want, right? That's my sense of what employers want. Like if you think about, Daniel, I know at one point you mentioned like the lesson model. The employers who work with lesson, they know lesson. They don't know the 8 individual community-based organizations, and they want that. They want a hub that is just the go-to source for talent, and that's in our goals as a network, right? Like how do we as a network be a go-to source for talent that one employer can come to and get, a healthcare tech from Gutman and get a CMA from FIPS or whatever it is that, and a medical biller, but they don't know that that person's coming from 5 different agencies. They know what can be fulfilled by the healthcare sector network. So I'm not sure, in this kind of inside baseball portion, like maybe there's a portion of each meeting we want employers at.
Yeah.
And we could think of it that way, like what is the portion and what's the conversation that we want them in the room for that informs as we complete the design of this. And I leave that to all of you to dictate to us to say, you know what, bring them in so we can hear exactly what their job demand is, exactly what the skills are now, because we met with Memorial Sloan Kettering 9 months ago and it's changed. And bring in someone from Montefiore to do the same, and bring in someone from Mount Sinai to, and we can make that happen. We're happy to. And I know many of you can make that happen too. Greg from DocGo would come talk to this group, right? So we just have to be strategic about it because you don't want to miss the moment of engaging them correctly. Does that make sense?
No, I got it. It definitely makes sense. I think, in hearing you say that, I'm understanding, right? I mean, we all work with employers at different levels. And I think basically like the point you're getting at is like, let's get our shit together and then get to them. And then they'll be like, all right, this makes sense. And we're on board. Like, totally get that. I also think to the point where you mentioned like Memorial Sloan, and I know that they were here and we were trying to have some follow-up sessions, but I think maybe that's a good starting point to look at each respective partner organization in place that's committed to doing this, and we have the MOU in place. Who are our existing partnerships that we have that we can maybe leverage and say, hey, we're a part of this collective network, would you be willing to at least come one session? Another session is another person's employer, partner, and so on and so forth. And then use those kind of individual sessions through each partner organization to kind of, talk to certain points. And we would obviously have to identify what are the key areas based on looking at the service delivery model that we would want to accomplish. And what are the areas that we'd want to specifically go over and not make it so large. I think for us, it's fine, but looking at that and then from there, once they've been a part of it, we can maybe say, hey, we invite you to come to this healthcare network, model, which is a collection of X amount of, providers that we've gone together. We could use the lesson model as like, here's evidence-based model that has been used before with this amount of success. Here's what we'd like you to do. And here's how we'd like you to be involved. And then get like, LOI or partnership agreement and, in line at that point in time after the stuff has been done. Yeah. So I think that makes sense. Yeah.
Yeah, I agree, because when we, a bunch of us in this group submitted for the Good Jobs Challenge together.
Yeah.
And to do that, we got letters from employers.
Yeah, yeah.
Signed on, some with soft hiring agreements, right? So, there's this network of employers that we can easily tap into. I think just us being really sure of what we want to hear from them.
Mhm.
Is it what are their own pain points in finding talent? Is it that there's so many things that we can learn from them, I'm sure.
Mhm.
But yes, there is a piece of it where, going back to your original question, like having them here now, I do think there could be a trusted one or two partners that are in the stage of designing a model that could weigh in on that. I do think that's important as well. Justine, I see your hand is up, so I'm gonna toss to you. Yeah.
So again, I really appreciate a lot of the insight that comes from this group. And I think there are so many different points of experience. And so I have just sort of gotten into workforce development and sort of managing workforce development in the last year and change. And so a lot of this stuff is new. And I'm wondering if there's a space for something to come from this group, like the skills mapping. I'm so excited about that. I can't wait to attend that. And so wondering if there maybe is a place in this sector to network to find sort of best practices or talk about best practices for engaging employers at really high levels. So instead of talking directly to I don't know, CVS on the corner of 96 and 3rd, we're actually talking to the person at the top about how to get into jobs within that company or funding sources, because it sounds like there are different levels of experience here, and I really want to maximize on that. But yeah, that's sort of a thought that I have as I'm hearing folks speak about what they're doing at their organizations. And I'm I would love to bring that to the Isaac Center, figure out how to do that, but I wouldn't know where to start.
Yes, I agree. And these are all things JobSource is happy to be working on the side, bringing people to this table. We often ask you, so maybe we should do a round again of who's missing, and specifically not just employers, but a specific employer or a healthcare network or something like that, or a CVS or something like that. I'm not sure, if people have specific people in mind. I've been speaking with some policy folks, and Curtis gave me some interesting information around policy advocacy for people with backgrounds. And there's a case study of a healthcare network in Cleveland that's a hospital-led healthcare network. We could bring them to come talk. Brads of Life, I don't know if you're familiar with them. We work with them through the 110 Coalition, which they're both national. They did a case study with the Cleveland healthcare network. We could bring someone in from that to talk. So yeah, we're game to bring in some experts or some people to this conversation that you think could help inform what we build. Curtis.
I've been thinking in the spirit of a random request, if that's okay, where we're at right now in the meeting. One thing I would love from a network that's not necessarily on here, I'm very interested in what's it, Lightcast is the new Burning Glass, but it's very expensive for one license, around $10,000. Would it be possible, or is it if anyone interested in trying to explore some way to get a shared license where we could maybe pay the 10,000 together, split it up, and then maybe get assigned days where we log in to Lightcast? I don't know if we have the budget to do it on our own. That was definitely a barrier at my last job. But I don't know if that would be something that the network, I really find that the real-time labor market data from the online job ads is super important to understanding our labor market. And I don't know if that's a possible way to get access to real-time labor market job ads that people would want to discuss.
That's a really interesting idea, to do a shared license on something like that. I know Jobs First is currently partnered with Sky High, which I just dropped in here, and just,
Okay.
thank you for giving a shout out to our Skills Mapping Academy, which Curtis, maybe, you probably didn't even see the RTP we put out, a request to participate we put out. So if you're interested, let me know. And I might know someone who could squeeze you in the cohort if you want to learn about it. But we're launching the first cohort of what we're calling the Skills Mapping Academy. Sky Hive does a lot of what Lightcast does. We're using it in a different way for this initiative. We're using it from a job seeker's perspective to come in, so they don't see the type of labor market information that's informing all of the recommendations and skills assessment and everything that they get. But Sky Hive says they have like 1 trillion terabytes a day of information that comes into their system. It's massive. And it's lots of labor market information. I know some of the folks at Lightcast as well, because they're the merger of Burning Glass and MC, I think.
Yes.
And their stuff is great. I'm not saying Sky Hive over the other. It just doesn't do all the things that Sky Hive does from the job seeker perspective. So maybe, if you want to come like first to have a tour or visit of the Sky Hive platform, we could talk about that, because for at least through October, we're giving people no cost access through our account. But it does limit, because it's a no cost access, it does limit the labor market information that you see. But it's being used in the back end, and I could always pull a labor market report for this group for sure. And we looked at Lightcast, it was way more than 10,000. I don't know, maybe you got a better.
Oh, really? Yeah.
better
I mean,
price.
you always have to negotiate with them. They don't put it public, so you have to be like,
so-
oh, I'm not interested. Then they're like, well, maybe it's like a cable company. I'm gonna quit. Okay, I'll give you a better price.
Okay,
So-
good to know.
Yeah, and I don't know what it is now, but the last few, you can a single license for 10,000. I mean, it's also how you say it. Like, I don't tell them that it would be shared, but then I use a Gmail and then I share it.
Okay,
That everyone can log into. But if so there's different pricing patterns. But anyways.
yeah, we are using something before we started with Sky Hive called Jobs EQ that does a lot of what you're talking about. And with this group, we showed a lot of data reports from Jobs EQ. I'll make sure that you can see those decks from the earlier meetings, Curtis. And if you see something in there and you're like, hey, I would love an updated report of this, like I see this in the deck, and can you pull me, we can share stuff like that with this network anytime.
Okay.
But something to explore, because 10K cut across 10.
Yeah,
orders.
that's totally affordable, but with
Exactly.
one, it's too much. So, okay, cool. Well, I'll put a pin in that. If people are interested, we could talk about it again.
Absolutely. What other ideas? What other things do you want? The wish list. I love this. Maybe there's a blank space in the feedback form, Megan, for people to put wish list items. People are like, if I only get one, I don't want to say it yet. I'm not sure.
I think for me, and I'll add this to the document, we're always looking for training space. So if you have access to partners or folks who have building conference rooms that are available for us to host training sessions, or even if it's 1 or 2 sessions, that would be great, because it also allows for us to sort of remove ourselves away from our sort of building and get our participants in a new space. So that's something that's always on our wish list.
That is definitely something to put out there to this group, because you never know who's got space.
And Justina, please remind me what organization you're from.
So I'm with the Isaac Center, which is merging with Goddard Riverside, but we are located on the 93rd Street and First Avenue.
Okay, I'll definitely follow up with our space, since it's new, and I'll go ahead to our director of the building and see what's available.
Nice. I appreciate that. Thank you so much.
You're welcome.
Any thoughts? This has been really great. I appreciate a lot of brain power is going into the meeting today, and you guys are thinking, and this is helpful for Megan and I always to hear what you're thinking about. All right, Megan, do you want to, I don't know where we're at in the deck, but I will pull it up and see.
Yeah, I was just thinking of how I could kind of streamline this next section, because
Does it make sense to move to the toward the end, or is there something you want to go over here?
well, with the implementation tasks that are pending, I think that,
Here, let me start here and see if this works for you. Hold on.
sorry, guys, I'm pivoting in real time and not doing a great job of it.
Screen share. How's this look? I think it's like slide 23.
Yeah, so I'm gonna kind of just go through this a little quicker than I had originally planned, just for the sake of time. But I did want to review, when we first started talking about formalizing this implementation plan, Carrie reviewed some of these other deliverables. We're kind of tackling the biggest, most labor-intensive ones at the moment, being the logic model, which we've completed, and also our service delivery model. Both of those things are going to kind of dictate the pending tasks. So we wanted to quickly review what is pending. So it's governance documents, defining the membership roles and responsibilities, and then formalizing that into a document of our principles of operation that will be part of our MOU once we formally launch. Once we figure out service delivery, from my perspective, I think that will help a lot with the governance and the who's who. The budget is just putting the costs associated to the logic model and activities and the resources that we need. And then the narrative implementation plan is kind of just like the written out version of all of those items. So they all kind of just like converge on each other. And so we, with the logic model and the service delivery model, we had these two like little mini task force sessions, if you will. And we were hoping that maybe we could host one more of those between now and the April session, to kind of keep our momentum going so that we can have a formal, plan written up so that we can start, looking for funding and putting stuff out there. So we were going to go through this like other sheet and kind of assign volunteers and things, but for sake of time, I just wanted to ask first, would anybody be interested, and if there's a place in the feedback form for this too, would anybody be interested in hosting an in-person session between now and April at their site? Because there is interest from the group to visit other people's sites. So we thought, instead of coming to Deb's first, maybe we could do some time, like one half of a session could be visiting somebody's site and understanding what they do, and the other hour, whatever time is left, we can kind of pluck away at these pending items. Does anybody want to jump on that opportunity?
What's the date again, Megan? You said it, but
Anytime between now and April 20th.
We may be able to.
Okay.
Yeah.
Oh, I'm echoing. Am I echoing on?
A little bit, not too bad.
Okay, sorry, my computer is doing something very strange right now. All right, so Tara, I'm gonna maybe follow up with you individually. There's
Yeah,
also,
because I'll need to know like the exact dates or so, and then how many people, so I can see where we could fit in our space.
yeah, usually it's gonna be like 10 or under is kind of the
That's the average.
average attendance, yeah. And there's a space in the feedback form we're gonna drop in the chat where you can like make some notes about that too, if you want to like send it to me that way, or we can just email offline. And same goes for anybody else who might be interested, and we can see, what availability looks like across us. That sound okay?
Yeah.
Awesome. So I think, Carrie, if it's okay with you, I'm just gonna kind of put a pin in that piece for the moment,
Mhm.
just for the sake of time and kind of, I want to think about some of the things that we were talking about before we come together to look at that stuff. Is that okay with you and everybody else?
Yes, makes sense to me.
Awesome. Okay, so I think we can just go ahead and wrap us up. So I want to say thank you guys for being here always. And like I said at the beginning, I love the good vibes. I love the candor and feedback. It means a lot. It's the only way we can really get through the mess of designing so we can actually get to a formal thing. So I really appreciate y'all. Again, the volunteering to host an in-person session, you know, if there's another person who's interested, there's a spot to show that in the feedback form, and we can discuss that offline. And then, did you put the feedback form in the chat?
I did, yeah.
Thank you. So in the feedback form is hosting, providing additional thoughts around some of the topics that we've gone over today. And there's going to be a question in there asking you to affirm the implementation task you volunteered for, which is the thing that we skipped. But if you look at it and you see something like, oh yeah, I want to be a part of that conversation, just check that off and we'll take it from there. And as always, we will send a summary after the session with materials and all that good stuff. And I think that's that. Huge thanks to you guys for all that you're bringing. We really appreciate your commitment and dedication. And if anybody has any questions or thoughts, we will stick around to hear them. Otherwise, I give you back to your day.
The permissions on the feedback survey need to be shared. It
Oh.
says form could only be used by users in the owner's organization.
Good note. I will get on that.
Oh,
Oh, I don't have it from the back end. We'll fix it in the next.
all right, now.
Oh, you're in it?
You just click into that and see if that worked better for you.
Denied.
Really? Okay, I'll send it afterwards. You guys don't need to watch me do this. I don't know. I'm sorry. I'll figure it out and I'll send it via email, but please fill it out when I send it via email.
Thanks, everyone.
Thank
It
you.
works. Take care, everybody.
Bye.
Weird. Why is it like that? Why did that happen? I've never heard that before.
Hold on, let me see. So here's today's meeting, today's form, settings, responses. It says restrict to users under settings, restrict to users and jobs first is checked. So I'm going to uncheck it.
Where do you see that? Just so I can look for it again.
Under settings, responses, require sign-in, restrict to users and jobs first NYC. I don't know why it's always automatically clicked on, so I just shut it off. Oh, you just turned it on.
Yeah, I just turned it off. Sorry. That is so weird. I've never seen that before.
Yeah, it's automatically on, but maybe when you copy a form, it doesn't do that.
I didn't copy a form this time because I had problems with doing that last time. Okay, good to know.
It auto does that, yeah. You want to just send from the calendar invite, say the form is just right now because they have like 9 extra minutes, maybe they'll do it.
Mm.
Send it to the whole calendar list and say, the form is open source now, here's the link.
Okay, let me do email guests.
At some points, Curtis sounded like he had like a cynical tone.
Yeah, there's something in the way he speaks that's a little bit like, doesn't make me super confident.
Yeah. Oh, boy.
I hope that works.
Yeah, that will work if you, yeah, just turning that switch.
Oh, sorry, I'm getting like a weird options for emailing guests. I want to do people who replied. I'm going to do it to everybody. Okay. My computer's doing something weird. Not everybody is on here.
Not everyone's on the calendar invite?
Maybe I'm wrong. Oh no. All right, I'm just gonna send it. Did you get that?
Hold on, I'm trying to find my the right tab with email. My mouse keeps getting stuck on my other screen. Okay, here you go, inbox. Yep,
Okay, that was weird. Oh, okay. Yeah, I felt like based on the conversation we were just having and what they were bringing up and the way that I had planned to talk about the implementation, I didn't feel like it was going to match well.
yeah, it was because it's a mix of people.
Yeah, so I was like, I just don't want to like ask for volunteers specifically for this, because some of it we might be able to kind of piece a little bit of it together for them and just get feedback. So sorry for doing that on the fly.
No, that's